The prevalence of diabetes in Singapore is rising and is projected to reach 13.7% by 2030. Uncontrolled diabetes is associated with an increased risk of complications, the numbers of which are also rising. For example, new cases of heart attacks or strokes are expected to increase by 50% to nearly 30,000 events annually by the year 2050. Urgent action is required to improve the state of diabetes care. New diabetes medications and technology are available. In spite of this, only about a fifth of persons with diabetes achieve optimal control of glucose, blood pressure, and lipid levels. A major barrier to reaching treatment goals is therapeutic inertia, or delays in adjustment of therapy even when treatment goals are not met. Something that can help with this is increasing our patients' awareness of their health and their risk of complications. To address this issue, the JARVIS AI group brought together collaborators from SingHealth, the National University of Singapore, and AI Singapore to develop tools that accurately predict the risk of diabetes complications. The JARVIS MACE tool is an AI risk prediction tool which estimates the risk of major adverse cardiovascular events in persons with type 2 diabetes, including heart attacks and strokes. The tool was developed using data from the SingHealth Diabetes Registry, which holds data from over 120,000 patients from the year 2013. Through advanced machine learning techniques, the JARVIS MACE tool makes predictions using over 60 parameters which reflect various aspects of a patient's health. The JARVIS MACE model also uses longitudinal data to make risk predictions. In other words, considering aspects of the patient's health from the preceding years rather than merely at a single time point. This provides an enhanced representation of the patient's health status and enhances the model's predictive power over existing risk prediction algorithms. During the consultation, the JARVIS MACE model uses the patient's latest clinical and laboratory data to generate individualized risk predictions. The clinician then explains how the patient's risk profile compares with their peers of a similar demographic and against the entire diabetes cohort. Patients and clinicians can also visualize the risk reductions that can be achieved by optimizing their diabetes care. This information allows them to take control of their health and make informed treatment decisions. Artificial intelligence is revolutionizing diabetes care. Using the JARVIS risk prediction engine, providers can better identify at-risk populations, visualize disease trajectories, and have meaningful, personalized discussions with patients about their risk. This enables the provision of preventive rather than reactive care, averting diabetes complications and giving our patients longer, healthier lives.